Did you know that 1 in every 8 men will develop prostate cancer in their lifetime? Each year, this silent disease claims the lives of more than 30,000 men in the United States. The scary part is it often shows no warning signs, no pain, no obvious symptoms until it's too late. But here's the truth. Few people will tell you. Prostate cancer can be detected early. And if you know the warning signs, you could save your own life. According to the National Institutes of Health, prostate cancer is the most common cancer among men and the second leading cause of cancer death in men. The good news is you can reduce your risk and increase your chance of survival by recognizing these warning signals early. In today's video, Dr. Recheal from Vital Eternity, a board-certified urologist with over 20 years of experience treating thousands of patients across the U.S., will share with you 12 early signs of prostate cancer that most people completely overlook. They may seem small, but if spotted in time, they could save your life. Remember, this isn't just information. It's your opportunity to protect yourself and your family. So what are these signs? Let's find out right now. Imagine catching something as deadly as prostate cancer before it has a chance to take hold. That's the power of awareness we're diving into today, starting with one of the more alarming yet often ignored indicators: blood in the urine. If one day you look down and notice your urine is pink, red, or even cola-colored brown, don't brush it off as nothing. This condition, known as hematuria, could signal advanced prostate cancer, where the tumor is invading nearby tissues or blood vessels. Sometimes, the blood isn't visible to the naked eye and can only be detected through a simple urine test under a microscope. Sure, things like urinary tract infections, kidney stones, or even vigorous exercise might cause similar issues. But if you're a man over 40, especially over 50, it's crucial not to delay. I've seen patients in my practice at Vital Eternity who waited too long, thinking it was just a passing thing, only to face more aggressive treatments later. The key here is early detection. Studies from the American Cancer Society show that when prostate cancer is caught in its localized stage, the 5-year survival rate is nearly 100%. So if you spot this, schedule that doctor's appointment immediately. It could be the decision that keeps you healthy for years to come. Moving on to another subtle but frustrating change: difficulty urinating, or that nagging feeling like you can't fully empty your bladder. Have you ever stood there at the toilet, waiting for the stream to start, only to find it's weak, hesitant, or you have to strain just to get it going? And then, even after you're done, it feels like there's still something left behind. This happens when a growing tumor in the prostate gland presses against the urethra, the narrow tube that carries urine from your bladder out of your body. At first, it might feel like a minor annoyance, something you chalk up to getting older or maybe drinking too much coffee. But over time, as the prostate enlarges or the cancer progresses, it becomes a persistent problem that disrupts your daily life. In my 2 decades of helping men at Vital Eternity, I've counseled countless patients who ignored this early prostate cancer symptom, only to regret it when it led to complications like urinary retention or infections. Don't let it get to that point. Pay attention to your body's signals and get a PSA test or digital rectal exam to rule out issues early. Now let's talk about something that might sound unusual but is a real red flag for many: the inability to urinate while standing up. It may seem odd, but I've had patients tell me they suddenly find it easier or only possible to urinate while sitting down. Why does this happen? An enlarged prostate, or one affected by a tumor, can obstruct the urethra so severely that gravity alone isn't enough to help the flow when you're standing. Your body adapts by changing habits, but this isn't normal. It's a warning sign that something's blocking the pathway. If your urination routine shifts without explanation, don't dismiss it as a quirky coincidence. Treat it seriously, especially if combined with other symptoms. Early intervention through screenings like those we recommend at Vital Eternity can make all the difference, turning a potential crisis into a manageable condition. Another uncomfortable clue that often gets mistaken for something minor is a burning sensation when urinating or even during ejaculation. That sharp, stinging pain might make you wince and think, oh, it's probably just a UTI or something that'll pass. But when prostate cancer irritates the surrounding tissues or inflames the urethra, that burning persists and doesn't respond to over-the-counter remedies. Many men, in my experience, push through it, assuming it'll clear up on its own in a few days, but that delay can allow the cancer to advance. Prostate inflammation from tumors can mimic infections, but ignoring it risks missing the window for less invasive treatments. If this hits home for you, remember, knowledge is power. Getting checked with a specialist can uncover the root cause and set you on a path to recovery, potentially avoiding more severe outcomes. Frequent urination at night is next on our list, and it's one that sneaks up on so many men. Waking up once or twice might be par for the course as you age, but if you're jolting awake 3, 4, or more times every night to rush to the bathroom, it's disrupting your sleep cycle and leaving you drained and foggy-headed the next day. This nocturia, as we call it in medical terms, often stems from an enlarged prostate or tumor putting pressure on the bladder, making it feel full even when it's not. I call it the silent sleep thief because it doesn't just rob you of rest, it chips away at your immune system, energy levels, and overall well-being over time. At Vital Eternity, we've helped men reclaim their nights through targeted advice and early detection strategies. If this sounds familiar, track how often it happens and discuss it with your doctor. It could be an early prostate cancer symptom worth investigating. Unexplained weight loss is a more systemic sign that shouldn't be celebrated if it's happening without effort. If the pounds are melting away despite no changes in your diet, exercise, or lifestyle, your body might be in overdrive, fighting something serious like advanced prostate cancer. Tumors can alter metabolism, increase energy expenditure, or even affect hormone levels, leading to this unintended slimming. Don't pat yourself on the back thinking, hey, I'm finally getting in shape without trying. It could be a distress signal from your system. In my practice, I've seen this paired with other symptoms, and catching it early through blood tests or imaging has saved lives. Stay vigilant. If the scale is tipping unexpectedly, pair it with a full checkup to ensure it's not masking a deeper issue. Bone pain, particularly in the lower back, hips, or ribs, is a warning that demands attention if it's persistent and unrelated to injury. This isn't the occasional ache from overdoing it at the gym. It's a deep, unrelenting discomfort that doesn't ease with rest or standard pain relievers. When prostate cancer metastasizes or spreads, it often targets the bones first, causing inflammation and weakening. If the pain starts spreading or intensifying, it's time to act fast. Delaying can lead to fractures or more widespread issues. From my years at Vital Eternity, I know how transformative early scans like bone imaging can be in managing this. Persistent fatigue is another deceptive symptom, that bone-deep exhaustion that lingers no matter how much you sleep or relax. It's not just feeling wiped out after a long day, it's a constant drain that affects your work, relationships, and joy in life. Cancer cells demand energy, and when prostate cancer is at play, it can disrupt blood cell production or hormone balance, leading to this overwhelming tiredness. Often dismissed as just aging or stress, it can persist for weeks or months. Listen to your body. If rest isn't restoring you, seek medical advice to uncover if it's linked to prostate issues. Blood in semen is a startling discovery that no man should ignore. Spotting red or pink streaks after ejaculation can be shocking, and rightfully so. It often indicates damaged blood vessels in the prostate due to a tumor. Even if it happens once and vanishes, recurrence is a clear call to get tested. In my consultations, men who've acted on this have caught cancer at stages where treatments like targeted therapy are highly effective. Weakness, numbness, or tingling in the legs or feet might seem unrelated to the prostate, but it's a critical sign if cancer spreads to the spine and compresses nerves. This can start as a subtle pins and needles sensation and escalate to mobility issues or loss of bladder control. Don't wait for it to worsen. Early MRIs can pinpoint and address the cause. Pain in the pelvic area, lower back or upper thighs is often a dull, spreading ache caused by tumor growth, inflaming tissues, and pressing on nerves. Unlike typical joint pain, it resists common painkillers and worsens over time. Recognizing this as a potential prostate cancer symptom can lead to timely biopsies and better outcomes. Finally, erectile dysfunction that appears suddenly, especially if you've had no prior issues, could be tied to prostate cancer damaging nerves or blood vessels essential for function. Don't attribute it solely to age. Get screened, as early detection preserves quality of life. Prostate cancer develops when DNA mutations in prostate cells cause uncontrolled growth. Some risks are genetic. If your father or brother had it, your odds double or triple. Lifestyle factors like a diet heavy in red meat, full-fat dairy, smoking, excessive alcohol, and sedentary habits amplify the danger. African American men face higher rates in age over 50 as a key factor. Obesity and exposure to certain chemicals also play roles, making awareness vital for prevention. While no method guarantees prevention, you can slash your risk dramatically. Aim for a healthy weight through balanced eating. Load up on cruciferous vegetables like broccoli, omega-3 rich fish, such as salmon, and tomatoes packed with lycopene, which studies link to lower prostate cancer rates. Commit to at least 150 minutes of moderate exercise weekly, like brisk walking or cycling, to boost circulation and hormone regulation. Quit smoking, limit alcohol, and prioritize sleep. Most crucially, start regular screenings, PSA blood tests, and digital rectal exams from age 50 or earlier, say 45, if you have family history or are in a high-risk group. At Vital Eternity, we emphasize these habits as lifesavers. You've now armed yourself with knowledge of these 12 early warning signs of prostate cancer, subtle cues that could mean the difference between a full life and a battle fought too late. This disease strikes silently, affecting millions worldwide, but with early action, survival rates soar. Don't become a statistic. Tune into your body, schedule those checkups, and adopt protective lifestyle changes today. If this video opened your eyes to potential risks, hit that like button, subscribe for more health insights from Vital Eternity, and share it widely, especially with men over 40. One share might just save a loved one. For more on everyday habits harming your prostate health, check out our next video linked right here. Stay proactive, stay healthy. Your future self will thank you.